So for my job, I chose to become a chiropractor. And I wanted to do this because I've always envisioned myself in some medical field. And I think it would be good for me because it's something that's been suggested to me by my family, even though that's sometimes in a humorous way. And it's something that I think I could excel in. It's less risky and stressful than other jobs, like a surgeon. That patient's life might actually be in my hands and depend on how steady they are, which I don't like the thought of that. And it would allow me to help people get on with their lives and reduce their pain. And if I want to pursue this, I need to prioritize classes such as anatomy, especially human anatomy, because that's a huge part of my job. So the working conditions for a chiropractor narrow down into two groups mostly, clinical work and then management work. Since most chiropractors are self-employed, management work is like any other boss. You would hire employees and pay them. You would pay utility costs and taxes for your site. You might do marketing for your business. And the clinical work every chiropractor will have to do, even if you're not the owner. You would treat patients by performing spinal adjustments or adjusting their neck or other joints. And you would instruct them on home exercises and give them other health advice like diet, changing that up, and that helps. You would meet with a new patient, review their history, discuss the problem, evaluate what's wrong with them, and devise a treatment plan. You would follow up with existing patients by seeing how well they're keeping up with their exercises, asking whether their pain is subsiding or increasing or if it hasn't changed at all. And you might attend a staff meeting every once in a while. So the education to become a chiropractor is like most medical schools. You need to obtain a bachelor's degree, and that's 4 years of college and some specific classes like organic chemistry. And then you need to apply to a doctorate of chiropractic program, and there are 16 colleges in the US that offer this, and they will accept you based on what your bachelor degree is sometimes. So that can alter what you want to major in college. And then after that, you need to pass the National Board of Chiropractic Examiners exam, and that will give you your degree, so you will become a doctor. But to obtain your license, that varies by state. And this is the most general that you need, and most states will accept this and give you a license to practice. So for my colleges, I decided to keep it as close as possible because it is expensive when you total it all up. And the tuition costs are based on a 4-year program. They don't include bed and board or books. And I chose SDSU in Brookings, South Dakota. It's around $36,000. And University of Sioux Falls in Vermillion, South Dakota, it's $37,000. And then my graduate choices, I have Northwestern Health Sciences University. That's in Bloomington, Minnesota, which is near Minneapolis. And they are $46,000 for 4 years. And then Logan University is in Chesterfield, Missouri, and that's near St. Louis. And they are slightly more expensive, but it's very similar in price. So for a chiropractor, a large part of your job is being a diagnostician. So you need to have problem-solving skills. You also need to communicate with your patients by asking questions and figuring out what specifically is wrong with them. And you need to have a thorough understanding of how the body works in the muscular system, the skeletal system, the neural system. And, so you don't paralyze them. You need to be able to operate an X-ray, which is something you will be trained to do in your clinical work. And you need to use software like Microsoft Excel or spreadsheets or something. Chiropractors, it's becoming a more popular form of treatment, and that influx in popularity creates more job demand. And so the job growth is increasing. According to the US Bureau of Labor Statistics, it's increasing by 4% annually from 2019 to 2029, that's a typo. But some sources that I found said it would be as high as 10%. But with those demands, since you can be self-employed and just make a job for yourself, it's not that competitive, but you are competing for patients and things like that. But there are really desirable government positions, like working for the VA. And that's really nice because you can have a paid vacation and a stable amount of income, no matter what. So there's competition for that position. So the pros of this job is that it's very rewarding to help people. It's a very fulfilling experience to relieve people's pain with your hands and not cut into them or something. If you are a business owner, the hours can be flexible. During my interview, I learned that some chiropractors work one evening a week or only visit one patient a day. So that's nice. It's low stress, and there is a steadily increasing job outlook. But the cons of this are that the education and training is very challenging and very expensive. You'll most likely have a lot of debt for years, because chiropractors don't make that much. You'll typically have no vacation, because if you are the business owner, if you have a vacation, you're not seeing patients, you're not getting new patients or seeing existing patients. So you will lose income from that. And you might need to start your own business from scratch, which is really hard to do. And being an associate chiropractor working under another chiropractor brings low income, so even less than a normal chiropractor would make. The average salary is $70,000 a year. Terrible at that. And the 25% highest paid chiropractors earn almost $100,000, and the 25% lowest paid chiropractors earned a little higher than $50,000 a year. But the most paying city for a chiropractor is Naples, Florida, and they pay $235,000 a year, around that. So related occupations, you can be a massage therapist or a physical therapist, an occupational therapist, or a physician. These are all pretty similar jobs. In specialty careers, you can specialize in orthotics, pediatrics, nutrition, and sport rehabilitation are really big for high schoolers and things like that. And radiology and neurology are other options. So in my interview, I interviewed Dr. Chris Pearson. He goes to my church. And I asked him to describe a typical day of work. And his days are mostly clinical. So he sees a couple of patients, and that takes up the most of his time. And he also sees around 15 patients, and that takes even less time to see one or two. Most people visit a chiropractor because of lower back pain and neck pain. I also found that it was really interesting that most chiropractic students drop out in the first year. He decided to become a chiropractor because he was interested in science and he knew many chiropractors. And in high school, when he job shadowed to figure out what he wanted to do in life, he really liked the chiropractors that he knew, and they seemed less stressed than all of the doctors. And he also did not become a physical therapist because he wanted to become a doctor, but now they are doctors, so that backfired. And his most favorite part about being a chiropractor is helping people, but he hates to start a business from scratch. And all that's left is works cited and pictures cited.